Let's discuss the PAMHUGSFOSS. PAMHUGSFOSS is also a mnemonic like Secura. The full form of PAMHUGSFOSS is P for previous history, A for allergy, M for medical history, H for hospitalization. And in hospitalization, we also add along with that ITS, I for illnesses like hypertension, uh, increased blood sugar, diabetes, or cholesterol, or any other serious illness. T for trauma, and S for surgeries. Then we hug, HU, U for urinary complaint, G for gastrointestinal complaint, S for sleep pattern, F for family history, O for OB-GYN history, and S for sexual history, and again S for social history. Let's start with the previous history. So the question will be like, have you ever had the similar complaint in the past? That's it. Be specific on the question. Don't give any chance to the standard patient to ask you like what or something like that. Just, have you ever had any similar complaint before? That's it. This is the question. Then comes the allergy. So do you have any allergies? This become again your open-ended question. Some may consider it as open-ended, some may not. It's your choice. Then about the medication, and for medication, so are you taking any medication right now, or are you on any medication? This will be the question. Then comes the hospitalization, and as I told, include ITS, I for illness, T for trauma, and S for surgery in that. So for hospitalization, have you ever been hospitalized? If patient say yes, then ask question accordingly, like for what, for how long, and was he cured after he was discharged from the hospitalized or from discharge from the hospital. Then comes for illnesses like have you ever been diagnosed with high blood pressure or high blood sugar, or how about high cholesterol level? Patient will reply accordingly, and if he says anything yes in that, then you have to ask about so does he take any medication for that, does he take them regularly, does he monitor them, and you have to say accordingly. And if it is the patient of high blood pressure, blood sugar, or cholesterol level, then you have to counsel. You can counsel right now, you can counsel after the history, or you can counsel in the conclusion, but you have to counsel. You cannot forget that. Then comes history of trauma. Have you had any accidents, or have you had any injury, or have you had any trauma? Then comes certain surgeries, like have you ever had any surgeries? These are the questions. If the case is not at all relevant to these questions, then you can skip off, because you have to calculate time accordingly, and you have to go in your case according to that. About urinary, that have you noticed any change in your urinary habit? I think I forgot to talk about to use transition here. So when I start the past history, I have to tell the patient that now let's talk about your past medical history. Now let's talk about your allergic history. Okay, then comes the GI history. GI history is mostly we have covered in our associated symptom of the Secura, but the remaining thing is weight. We can use there also, and we can ask here also. Have you noticed any change in your weight recently? And one important history is travel history. Have you traveled anywhere recently? This particularly is very useful in the case of diarrhea. Then about palm hugs means make it HUGS, so S for sleep pattern. So have you noticed any change in your sleep pattern? Particularly very useful in the patient of depression. Then comes the family history. Now let me ask you about your family history. Does anyone in your family has a similar complaint too? Be specific about the question. or if it's a case of high blood pressure or blood sugar or cholesterol level in which the family history has relevant, then we have to ask does anyone in your family has high blood pressure? Patient will reply, then high blood sugar, patient will reply, or high cholesterol level, and then you can write down accordingly. Now comes the sorry. Now comes the obstetric and gynec history. The way to ask is just divide in GPA and menstrual history. So it will be G for gravida. So have you ever been pregnant? And if a patient say yes, then ask how many times. About the para, how many times have you given birth? About abortion and miscarriage, have you ever had any abortion or miscarriage? Then comes the menstrual history. First thing to ask is when was your last menstrual period? Then, are your periods regular? And do you notice any spotting? You can ask also that how many pads you change during your period. Next comes the sexual history. So, as I already have told that while asking the sexual history, the confidentiality statement is must. Like, we will first use transition. Now let me ask you about your sexual history, but before that, let me assure you that whatever we talk will be highly confident between you and me. So this is a statement of confidentiality. So